So sometimes a routine endoscopy is not able to diagnose all the diseases of the intestine. There are some diseases of the organs of your gastrointestinal system, such as the pancreas, bile duct, lymph nodes, and some deep organs. They cannot be picked up by endoscopy. For this, nowadays we have a novel technique called as endoscopic ultrasound, or EUS. Now what is EUS? So it is basically an ultrasound probe which is at the end of the endoscope, which helps to assess and see these deeper organs properly, such as the pancreas, the bile duct or the gallbladder, and the lymph nodes, whether they are any significant sized or anything to worry about. So this is a technique which comes under the heading of advanced endoscopy. With the help of this endoscopic ultrasound, we can do a lot of diagnostic tests. There are many indications of this endoscopic ultrasound. The commonest one being diagnosis of pancreatic tumors, taking biopsies of pancreatic tumors, taking biopsies of the lymph nodes to know whether they are benign or cancerous, taking biopsies from the bile duct to know whether there are malignancies or cancers in the bile duct, seeing the gallbladder, whether there are any stones in the gallbladder or some sludge or debris or particles in the gallbladder or bile duct. So all this information we get by doing an endoscopic ultrasound. It is similar to a routine endoscopy. We have to do it under sedation. There are a lot of accessories that we can put through this endoscopic ultrasound so that we can diagnose a lot of routine conditions which previously were difficult to diagnose. So endoscopic ultrasound combines two of the best techniques that we have. One is on one hand you have the endoscope, second hand you have the ultrasound probe to see the deeper layers. So it is combining both the techniques. So it gives us very high resolution images and are able to see very, very deep pockets in your intestines where the diseases can be hidden and will be left undiagnosed for years. There are various layers of the intestine that can be seen, like stomach, duodenum, and small intestine, as well as various layers of the pancreas can be seen. This procedure can also be used for treating purposes, not just for diagnosis. For example, we place various stents in the pancreas, we place various stents in the small intestine with the help of the endoscopic ultrasound to treat number of diseases. So many a times with the help of this endoscopic ultrasound, we stop the bleeding from the various veins in the intestine as well. So it is a very, very useful tool. So the take home message for this endoscopic ultrasound is that advanced endoscopy is a very important branch of endoscopy nowadays. A lot of uncommon diseases can be diagnosed, or diseases which were common but were not easily diagnosed are now being diagnosed properly because of the advent of endoscopic ultrasound.